He presents to the medical office complaining of a retrosternal chest pain that appears when he climbs a flight of stairs to walk into his apartment. Every time he has to rest in order to experience relief from the pain. From the medical history, what is important is that he has orthopedic prosthesis, hypertension, diabetes mellitus, and the left bundle branch block. His last echo was done a pharmacological stress test. We will follow up with a cardiac stress test. We put him on nitrates, or we do a coronary angiography. Indeed, he cannot run, but in the same time he has a left bundle branch block, meaning that any EKG is out of question. More importantly, he has an ejection fraction that is low, so any other stress on his heart won't be sustainable. If we consider the risk assessment for coronary artery disease, we'll observe that he's in the high risk class. Therefore, he needs a coronary angiography. How do we calculate this pretest probability for coronary artery disease? Our pretest probability can be considered low, intermediate, and high. Low is for the men that have less than 40 years or the women with less than 60 years that have a non-anginal chest pain. Also, the low class includes a typical angina in women less than 50 years. For low-risk patients, we will consider cardiac exercise stress test. The intermediate population is represented by males that are more than 40 years and females that are more than 60 years. They have non-anginal chest pain. If we have a patient with atypical angina, then we consider him intermediate if he's or she is more than 50 years. Or in the case of typical angina, we consider the males that are more 60 years or females that are less than 40 years. The approach is the same. We go for the stress test. If the patient cannot exercise, we do a pharmacological stress test. In high-risk patients of coronary artery disease, we consider patients that have typical angina and that are males. They are more than 40 years, or in females that are more than 60 years. The same approach, cardiac stress test, pharmacological stress test if the patient has problems with his EKG, or if the patient cannot exercise, and if those two above are not possible, then we go for coronarography. If you enjoyed this video and you'd like more info on cardiovascular disease, make sure you check out the previous live stream. Subscribe to be notified of the upcoming live streams for Step 2 CK.